لا بربخ على ويل تشير، حكيت معك.
You're too strong. Too strong. Too strong. Thank you.
للأسف يعني حصار علينا، ما في مية، ما في كهرباء، ما في مقومات الحياة اللي إحنا نقدر نعيش فيها. في مرضى كتير هون ما قادرين نعالجهم، ما في الأدوات اللازمة، الأشياء الدريسنج اللي إحنا نعملها ما موجودة. بنحاول قد ما نقدر إنه نتعامل مع الوضع، ولكن هو وضع سيء نوعا ما.
استنى ناس برا طالع.
لا عادي. You want him to speak anything?
يلا خلص. ليش انت
بالراحة يا ست، قلنا لك المعلبات
من جميع النواحي. النفايات في مجمع الناصر الطبي في جميع الأنحاء. الوضع سيء للغاية، لا يوجد ماء، لا يوجد كهرباء، وحتى الأكسجين للمرضى لا يوجد.
We have space for 3 stretchers for sure, for now.
No.
3 stretchers.
هاف تاني. افتح. اوكي.
ايش اسمه؟ انت ايش؟
هذا pulmonary edema.
This week, member states from around the world are meeting in Geneva to discuss the new pandemic accord. This agreement is being developed, shaped and decided by the 194 member states that make up the World Health Organization. Building on the lessons of COVID-19, I broadly see 3 key benefits. The agreement would help countries drive a more equitable response, it will boost collectively health safeguarding, and it will enhance cooperation. And when the next pandemic does happen, it takes a whole of society approach to tackle it. That's why member states are designing an agreement to support countries to mobilize all sectors in a coherent response, including across governments, multilateral agencies, the private sector, and civil society. There is a rich discussion going on about the agreement, which will happen for several more months to come. There is progress, and I maintain confidence that by the World Health Assembly in May this year, countries will have agreed on a new pandemic agreement that sets out a better set of parameters than we had during COVID-19. Ultimately, it will save lives and livelihoods while protecting national security and sovereignty. The health and humanitarian situation in Gaza is inhumane and continues to deteriorate. Over the past 3 days, WHO and partners have carried out several emergency missions to Nasser Medical Complex in southern Gaza. Around 130 sick and injured patients and at least 15 doctors and nurses remain in the hospital. With the intensive care unit no longer working, WHO has helped move patients, many of whom cannot even walk. On a broader level, Gaza has become a death zone. Much of the territory has been destroyed. More than 29,000 people are dead. Many more are missing, presumed dead, and many, many more are injured. Severe malnutrition has shot up dramatically since the war started, from under 1% to more than 15% in some areas, putting more lives at risk. This figure will rise the longer the war goes on and supplies are interrupted. We note with apprehension that the World Food Programme cannot get into northern Gaza with supplies. We need a ceasefire now. We need hostages to be released. We need the bombs to stop dropping, and we need unfettered humanitarian access. Humanity must prevail. Sudan, while not receiving much international media attention, is witnessing a humanitarian catastrophe. More than 10 months of conflict have had a deadly impact on the lives, livelihoods, and health of the people. Over 6 million people have been displaced internally, and nearly 2 million people have gone to neighboring countries. This is the largest displacement of people in the world. Half the population needs humanitarian aid, but partners cannot reach most of them. Already more than 14,000 people have been killed, and if the world turns a blind eye to the suffering in Sudan, many more will die. WHO is scaling up on the ground efforts to deliver health emergency response, respond to disease outbreaks, sustain disease surveillance, and provide life-saving medical supplies and equipment. After years of progress against cholera, the deadly disease has come roaring back in 30 countries, spurred on by conflict, poverty, the climate crisis, and global socio-economic inequality. Along with Sudan, the countries with the most concerning outbreaks right now include Ethiopia, Haiti, Zimbabwe, and Zambia. In October 2022, the International Coordinating Group that manages the emergency stockpile of cholera vaccines suspended the standard 2-dose vaccination regime in favor of a single dose only in response to outbreaks to stretch supplies. Despite this extreme measure, at the start of this year, the stockpile was empty. 0 doses are left, while 15 countries are reporting active outbreaks. We need the world to wake up to the rapidly growing threat represented by cholera. For immediate needs, WHO has released over $16 million from the WHO Contingency Fund for Emergencies. But to tackle cholera outbreaks around the world, WHO has issued an appeal for $50 million for 2024.
When we talk about emergencies or disasters, we assume we're going to be dealing with injured people, and people understand that. We assume that there may be epidemic risk because people understand that. But what's often forgotten is that displaced or refugee populations, or populations who've lost access to their homes and their medicines, or lost access to healthcare, also lose access to care for long-term diseases like diabetes, like hypertension, people with disabilities, people with mental health conditions. When a community loses a primary healthcare centre, when a community loses its hospital, when it loses its immunisation programme, there's more than just a loss of health. There's a loss of hope. There's a loss of community confidence. And that often forces people to move and migrate and to move away from where they are, where they can't get services, to somewhere else, which then deepens the problem because the community that ends up hosting them is now providing care for more than the number of people they can care for. So it triggers a whole series of negative things. And we need health systems that are capable of both responding to the acute emergency and being resilient and being able to have continuity of services for all of the other diseases. So that's what we mean when we talk about non-communicable diseases and emergencies. We can't forget them, and we must provide for them.
We need everything. The only thing we have now is few people in two AVs, few people from PRCS, few stretchers, and this is everything we have. So what we need everything else.
Check with something attached to the gas.
Sorry.
I told you. I want to express my appreciation.
Thank you very much. It wouldn't have been possible without you guys.
No, mate.
I absolutely, truly mean it. Yeah. A fresh cake?
We brought 18 patients from Nasser Medical Complex. Nasser Medical Complex currently is in a conflict zone, and right now it is without electricity, without tap water, without access to proper care.